It might be the end of 2020, but we are nowhere near the end of this coronavirus pandemic. So what will 2021 look like? Dr. Anthony Fauci told MSNBC's Andrea Mitchell, hang on to your masks at least until the end of the summer.
We can do both. We can keep the country open and we can abide by the public health measures. That together with a vaccine, I believe in 2021, we will see this behind us. It's going to take several months, Andrea. It's not going to happen in the first few months. If we do it correctly, hopefully as we get into the end of the summer, the beginning of the fall of 2021, we can start to approach some degree of normality.
NBC News medical contributor Dr. Natalie Azar joins me now. Dr. Azar, we are heading into the new year with vaccination delays, a new super contagious COVID strain, record hospitalizations and deaths, a lot still to deal with. Your take on Dr. Fauci's 2021 outlook?
Well, Allison, I think that he's taking a 30,000-foot look, and I would agree with his assessment. The next few months are going to be very, very difficult. As you pointed out, we are dealing with, in all likelihood, a much more transmissible strain that will be hitting, many parts of the country with, cold temperatures and people indoors. I'm hopeful that things will start to look different towards the spring and the end of summer as a greater majority of Americans are in fact vaccinated. But until then, as we've said repeatedly, the same things that have held true for the less transmissible strain will hold true for this one. And that is to wear your masks and keep your distance and avoid indoors gatherings and keep washing your hands, Allison.
Dr. Azar, the CDC out with a new study today, and it says that since June, COVID rates are the highest in young adults ages 18 to 24. A lot of young people think they aren't at risk for COVID, or high risk at least. Can you explain why that is not exactly the case?
Sure, Allison. The way I break it down is this. If you're in that age group, there's one of four things, or maybe a combination of four things that could happen to you. In the worst case scenario, you could die from this illness. We know that that can happen even if you are young and healthy. You may recover without incident. You may, on the other hand, recover but experience what we call long COVID or long hauler syndrome, which is a myriad of different disabilities that can significantly impact your life. But I think the most important message and take home is that in spite of all of those other outcomes, what you can do and what we do know you do is transmit very readily to others. And that is something that I really think that the young adults in our country need to understand, that it isn't just about them, but that their actions have consequences and they can transmit to other folks who may die from this disease or are more vulnerable to a severe outcome.
Dr. Azar, we can't talk about young people without talking about schools. Over in New Jersey, the state's largest school outbreak infected 83 kids and teachers. We know that kids are not getting COVID vaccines just yet because the drug makers still need to finish their clinical trials with children. So is it going to be possible to open schools safely in 2021? I feel like that is one of parents' biggest questions.
It is, and I include myself in that, and I live in New Jersey, so the next couple of topics we're talking about directly impact us here. But look, I think it's been difficult for public health officials and experts to really make recommendations because a lot of the data gathering has been incomplete and it's been kind of inconsistent. So it's been sort of difficult to draw firm conclusions. But I think the growing body of evidence really does suggest that younger children, particularly under the age of 15, are very much less likely to get infected and possibly more important, are less likely to transmit to adults. That is probably the other way around, that adults are transmitting to children in schools. And we also know that kids are transmitting to each other outside of school. So that is at parties and at sporting events and things like that. At the end of the day, the success of a school opening really does depend on what's happening in the community. So if community spread is low, that'll spill over into the microcosm that is school. But we know that schools that are vigilant about mask wearing, try to urge social distancing, have good ventilation. I know because my kids always complain that they're cold during the day because the windows are open, can open successfully. But look, there's a lot of stakeholders. teachers, custodians, a lot of people at risk of getting sick. It's such an easy, puzzle piece to put together, but I am hopeful that school will be on the horizon in 2021 at some point.
All right, I have another New Jersey question for you. How about sports? Indoor sports can start again there next week. How can they make sure that they're safe?
I know. And so I actually am waiting to hear whether or not she just turned 13. My 13-year-old will be playing basketball this weekend, because indoor sports should be back up and running to just Saturday, January 2nd. And I just listened to Governor Murphy today in his news conference. He basically said this: if you can have a sporting event where you have up to 10 people in order to play the sport, meaning let's say a basketball team, 5 and 5 plus coaches, that they're allowing that indoors but without spectators. If you have a sport, let's say a singles tennis match where you only have 2 individuals playing and 1 umpire, you can have some spectators up to 10. I hope that they encourage ventilation. I hope they encourage mask wearing. I've told my daughter that if she's playing, I'd like her to play in a mask. We'll see how it goes. It's almost like a medical decision making. You're always weighing the risk and the benefit. Taking this away or allowing this pause in sports to continue for the winter sports in New Jersey would mean the end of the sports season, for all the kids or most of the children, which does have repercussions also. So again, just like school, it's not an easy answer. We'll see what happens. He said he will very easily pull the trigger if they can trace individual cases to breakouts.
Well, I hope that they are able to play and do so safely. I know it has been so tough for kids having to be home, not being around their friends, and a very happy birthday to your daughter, who's now 13.
Thanks, Alice.
One more question for you, Dr. Azar. Bringing the year full circle, China, where this pandemic started, just approved its COVID vaccine. What can you tell us about it? What do we know?
Well, so here's what we know, Allison. It's a little interesting because we actually don't have a lot of publicly available data on its safety or efficacy. What they are reporting is an efficacy of close to 80%, which is definitely good. Not quite as good as the Pfizer Moderna 95%, but definitely a very, very good number. And we also know here a few other advantageous things about it. It does use a conventional vaccine platform. It uses inactivated viral particles, so it's not a live vaccine. We also know that it can be stored in regular refrigerated temperatures, which, like the AstraZeneca UK and the Johnson & Johnson vaccine, will be really, really good options for the developing world. So we'll see. Experts have said we need to see all the data, but what we have at least been privy to thus far looks very promising.
Dr. Azar, thank you so much. And just a thanks to you. You have helped us figure out, work through, better understand what has been just an absolutely wild year. And we are so grateful to you and all of our doctors for that. Thank you. Let's hope 2021 is a little bit easier.
I agree with all of those sentiments, Allison. Have a happy new year.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.